I'm Dr. Bruce Sorkin. I'm a board-certified facial plastic surgeon in Beverly Hills, specializing in facial rejuvenation and rhinoplasty surgery.
So you had a rhinoplasty and the results didn't go the way that you want. What is the proper protocol on when to get a revision rhinoplasty and why does it matter? Revision rhinoplasties come in multiple different categories. Let me explain. Category number one is a patient who's had a rhinoplasty who, after about a year or so, realizes that there are some things that haven't really gone quite right with the rhinoplasty. Swelling has gone down, the changes in the skin have occurred, the skin has started to shrink wrap over the cartilage and the bone, and there may be some irregularities or maybe a little offset in one of the bones, or the tip is a little wider than the bridge is, or something that just doesn't look quite right or balanced in the nose, or doesn't look natural in the nose. In those cases, a revision rhinoplasty can be attempted around that 1 year mark or after, because there is continual change that can occur for a couple of years. In fact, many of these patients don't actually look for revision rhinoplasty until about 2-3 years later, indicating the importance of waiting because it keeps on changing. So if you're getting a small change made or a small little adjustment made, waiting a little bit longer is a good idea. Now here's the next category. Patient that has a rhinoplasty that wakes up from surgery and looks, and about 2 months after surgery, looks in the mirror and says, I don't like it. Tip is too wide, tip is too high, bridge is too wide or narrow or whatever. Those patients fall into a different category. That's a patient that is looking for a specific result, and that specific result will only be seen after the swelling has fully gone down and all the shrink wrapping and changes in the skin as it attaches to the cartilage and the bone have already occurred. That's when you can really see the issues. And that's when all the changes and the setup for healing has already occurred. So trust the process, let it sit, let it be there for a little bit longer, and let all the changes that are going to happen in the skin and the scar tissue occur before attempting it. In this category, it's appropriate to wait about a year. Here's the next category, and this is the one that's important. Some people have surgery and a month or two later they realize something is seriously off with their nose. There's a structural problem. The nose is completely off kilter, shifted to the side, tip is not properly projected, and breathing is off. So many things can be wrong. Those patients fall into a totally different category. As the skin is healing and as the shrink wrap is happening, of course you're going to see different changes occur. But after the shrink wrapping of the skin happens and after the healing has completed to the point where it's solid and the skin and scar tissue and so on are stuck really well to the bone and cartilage, it is even more difficult to lift those structures back off of the skeletal structures of the nose, meaning the bone and the cartilage. So sometimes in these kinds of patients, it's better to intervene sooner than 1 year. And this is a really critical category. These only come around once in a while. In my practice of 16 years, I've done this about maybe 5 times. But these are patients that when they come in, I look at them and I see a problem that isn't going to get better with time, isn't going to change favorably with time, and isn't going to go in a direction that I need to evaluate or see before I attempt to do a revision, but is just structurally off and wrong. Something is seriously off about the nose. Those patients need to be fixed sooner. And the reason for this is, once again, as the skin shrinks down and sticks down onto the cartilage and bone, it makes it increasingly more difficult to fix these patients. So if you are one of these patients, if you've been in this category and you've been told, you should wait a year, you should wait a year, you should wait a year, and you don't see this happening very often, so you have to get proper consultation. So I would recommend going to a surgeon who's really very well versed in doing revision rhinoplasties and hear it from the horse's mouth. Is this going to get any better? Is it going to change favorably? Or do you really need to see what direction it's going in before you attempt any kind of revision? Or is this structurally off and can I get it done quicker? Hope this answers the questions about how long you should be waiting before you get a revision rhinoplasty. Of course, reach out with any questions and message me down below. I'm happy to go into further detail on another video regarding the questions that you've asked me down below.